Hi, welcome to Million Matters. We hope everyone is safe and sound. When we hear the word healthcare, the first thing that pops on our mind now is COVID 19. Yes, the one that has created a huge impact on our daily course. Like everybody, we also can't wait to get back to our daily lives to go out and explore. Today, we are going to have a peek at the top 10 healthcare countries in the world based on the healthcare index. But before that, for future such infotainment videos, hit the subscribe button. Let the countdown begins. Number 10, Finland. With a healthcare index of 75.79%, Finland stands 10th. The health expenditure of Finland corresponds to 9.2% of their GDP. Majority of the healthcare in Finland is offered by public service providers. The private sector, however, is very small. While the insurance is free in Finland, it is funded by the public tax system. In Finland, 72% of their population is reported being in good health, which is a slightly higher percentage than the EU average, that is the 67%. Number 9. Australia. Australia stands ninth with the healthcare index of 77.38%. The total healthcare expenditure in Australia, according to the reports of 2016, represented 9.6% of their GDP, which is an increase of 2.6% from the reports of 2013 to 14. According to the report of 2014 to 15, there were totally 698 public hospitals, which includes 678 acute and 20 psychiatric, with a total of nearly 60,300 beds, which is an increase of 1,700 beds over the previous year. Private hospitals in Australia are a mix of profit and non-profit. Number 8. Thailand. With a healthcare index of 77.95%, Thailand stands 8th. The expenditure of the health sector accounts for 3.7% of the GDP in Thailand. There are totally 1,421 hospitals in Thailand, which includes 1,074 public and 347 private hospitals. Thailand's medical industry has around 37,000 doctors all over the country. Furthermore, 60% of the pharmaceutical products were supplied via private hospitals in Thailand, and the rest were distributed through private hospital and as over-the-counter medicine. Number 7. Austria. Austria got the 7th place after achieving the healthcare index of 78.73%. The current healthcare expenditure of Austria as a share of GDP is 10.4%. The Austrian hospital landscape is diverse and complex. Overall, there are 271 hospitals with a total of 64,805 beds, with a share of 44.6% for profit hospitals and 55.6% for non-profit hospitals. Number 6. Spain. Spain stands 6th with the healthcare index of 78.88%. Spanish government spends about 9.2% of its GDP for healthcare expenditure. The total number of doctors in Spain averaging about 4 per 1,000 people. Hospital count. There are totally 723 hospitals in Spain, including 358 public, 298 private non-profitable and 144 private profitable. Spanish hospitals are the best for organ transplantations. 5 for France. With a healthcare index of 79.99%, France got the 5th position in the list. About 2/3 of the hospitals are owned by public and non-profit groups. France has a universal healthcare system, and 96% of the total population are covered by the health insurance. Even though the doctors make much less in France than those in some other countries, they are getting medical school for free. So that covers up with the other country doctors. They are spending a total of 11.6% of their GDP for their healthcare expenditure. Number 4. Denmark. With a healthcare index of 80%, Denmark stands 4th. In Denmark, there is a free public healthcare system which is publicly funded by taxes. In other words, people are paying through taxes. Danish healthcare covers everybody. Whoa, it's 100% guys. Denmark is one of the highest spenders of OECD. accounting of around 43% of the total health expenditure. Also, Denmark is spending 10.5% of their GDP for healthcare. Number 3. Japan. The innovative Japan bags the third place with a healthcare index of 81.14%. Seems like Japan is not only resembling technology but also healthcare. They are spending about 10.2% of their GDP for healthcare. With 100% health insurance, Japan stands as one of the best healthcare systems in the world. In Japan, the doctor per capita ratio is 2.06 is to 1000. That is, there is an average of 2 doctors per 1000 people. There are around 8,500 hospitals in Japan and 53,000 pharmacies with a ratio of 42 pharmacies per 1 lakh people. Japanese has the world's longest life expectancy with 83.6 years and the second lowest infant mortality with 2.1 deaths per 1000 lives born. Number 2. South Korea. With a healthcare index of 81.97%, South Korea got the second place. South Korean government are spending about 8.2% of their GDP on healthcare. The national healthcare scheme of South Korea covers 97% of its population. The doctor per capita ratio in South Korea is 2.34 is to 1000. South Korea has the best cancer treatment in the world and they are also having the overall highest cancer survival rate in the world with 66.3%. Number 1. Taiwan. With a healthcare index of 86.71%, Taiwan bagged the first position in the list. Taiwan has the universal healthcare system. Taiwan hospitals are also following a smart card system, a swipe of which gives their doctor an instant access to the real-time medical records. Taiwan's healthcare became one of the most prominent ones after changing its entire healthcare system from top to bottom in 1995. The doctor per capita ratio in Taiwan is 1.8 is to 1000. With only spending 6.1% of GDP in healthcare, Taiwan yet became one of the best healthcare country in the world. So that's all folks for today. Thank you for watching this video. If you like this video, give it a thumbs up and share your views in the comment section. If you haven't subscribed our channel yet, hit the subscribe button and share this video to your friends. Thank you.